As speaker coordinator this year, my goal has been to bring you speakers that benefit you as an individual as well as clients you might be serving, and that's really been my focus. We at the Leadership Board were talking about what's happened with the Affordable Care Act. Oh, Nico, hey. Just sit right there, sit, good boy, stay. Sorry, that's the therapy dog, and he was trying to eat all of Council on Aging's goodies. He's very clever. So, the Affordable Care Act has been through, there's been a lot in the media, but really what I wanted to do was ask John Lewis of J.C. Lewis Insurance, who's a member here, to talk about sort of brass tacks and how it's affecting us as consumers. So not just the big media points, but really bringing it down home to how it might affect us. And I think you'll find it quite informative. So, and he's also taking questions. He's willing to do that. So if you have any individual questions, you can ask those. He's willing to address them. So John at J.C. Lewis, come on up.
Great. Gotta flip on my microphone here. There we go. You hear me? All right, Bob, did you want this back this way?
Oh, no, you're good.
I'm good. Okay.
Let's get this out of the way.
Dual microphones, all right. Okay, I've got a few notes here because we want to make this as interactive as possible. I'd also like to encourage, I wrote down Brigham, Karen, Julie, Mark. I think you all are in the your health insurance agents, right? So if you have anything to interject into our talk today, because I assure you, I do not know it all when it comes to this. And if you have anything, if I've misspoken anything, chime right in. Love to hear from you. Okay, well, I am John Lewis, and I am, you want to throw it up there? Okay. I'm from J.C. Lewis Insurance Services. We've been there a little over a year now. We're at 100 East Street here in Santa Rosa. We provide health insurance consultation for individuals and families, people with Medicare, which is one of the reasons I'm associated with this group, and small businesses. And there's nothing less fun than listening to some bald chubby guy up here pretending he's a know-it-all when it comes to health insurance advice. So I'm not going to do that to you. What I am going to do is invite you all to, as I say, to interject and ask questions along the way. So I'm going to give a little 5-minute reprise of what I talked about back in October, because we didn't know a lot back then and we couldn't use this a lot. So what we're going to try and do today is provide you with some real examples, which will hopefully better serve you when we get to the end of this year, which will be the open enrollment period again. So, okay, Bob, let's see, we're not going to do anything just yet. Let's see here. Click on the lower right of the screen, and so pan down for me and get to the Shop and Compare tool, forgive me. Okay, and then come on down over here and go to Income Guidelines. Okay, and just bring that up there. I know it won't all be on there, so we'll leave that up there for the moment. Okay, so what's changed under healthcare reform? Well, you've heard a lot about people getting tax credits. So if you are somebody who has an income, and we'll go up to line 1 up there, one person in the household, between 138 and 400% of what's called the federal poverty level, you qualify for a subsidy. And naturally, if you are underneath that amount, 138 on down, you are automatically relegated to Medi-Cal. So this is kind of a defining line. It's made it real easy to do business with people that call in, because there's no guessing. And I should point out, even though theirs is not updated, there's a new version of this out too, where they've actually raised the bar. I want to say the 138% is now like 16,100, something along that. But it's not on their website, but it is out there if you need to know. So, okay, that's those two. Plans have now been standardized. They're now known as the bronze, the silver, the gold, and the platinum, which has made it really easy, again, to do business with folks. There's even a catastrophic plan for people under the age of 30. The fact of the matter is we don't use that a lot because it's very close to the bronze plan in price. So, what makes it so easy to do business with just 4 basic plans is that they're the same regardless of what carrier you're talking about and what area you're talking about. So a bronze plan with Health Net's like a bronze plan with Kaiser and the like. Rates have now been rates are now based on age, zip code, household income, and the benefit level you suggest. And then rates are no longer based on your health status, pre-existing conditions, or tobacco usage, which has been a big boom. And if you did not purchase health insurance during the period of October the 1st, which was the origination of the first open enrollment period, through March 31st, you are considered what is locked out. And you are not eligible to buy a plan for the remainder of the year until we get to the end of the year's open enrollment period, which, as luck would have it, is November the 15th through February the 15th of next year. So that would be the time, if you got in, you can make a change during that time. If you didn't buy originally, you can now buy during that time. Okay, and under special circumstances, yes, please.
Can you do questions during, or should we save for after?
Well, no, I was going to get to the end of this first little
Okay.
5-minute piece, and then I thought we'd open it up for some
Okay.
questions, and then we'll go into some
I'll
real
wait.
examples. Oh, I appreciate it, thanks. Okay, so next open enrollment. Okay, there are also special circumstances that allow you to buy outside of the open enrollment period, such as marriage, divorce, birth of a child, or most of the calls we're getting, people lose their jobs. So they're in a situation where they've got a job, got employee benefits, and all of a sudden they're out there, they can actually go to the exchange, and if their salary allows, they're subsidy eligible, or not, depending upon what they've made. And then probably the number one pain that we've experienced with people, and of course a lot of this we learned as we were going along, as did Covered CA and all the carriers, is that each carrier has a network of providers, and some network of providers are stronger than others in Sonoma County. So in Sonoma County, the carriers participating in the exchange are Kaiser. Their network remained the same. They're kind of our go-to guy. And then there's a mirror image of Kaiser called Western Health Advantage, another HMO. So then if you don't like HMO, you go to the PPO plans. So we've got Health Net, Blue Cross, and Blue Shield, and that's it. Well, as we started going through people wanting to select one plan over the other, the Blue Cross plans, let's say, were on the lower end of the spectrum from a pricing standpoint. So we had a lot of people choosing Blue Cross. Now, the one mistake we made, they made, and really all the insurance carriers made, is they didn't give us enough information about doctors opting out of being providers any longer. So what we experienced is that people, if somebody looks at Blue Cross at $200 and Blue Shield at $300, Health Net at $500, well, they'll automatically go to the Blue Cross plan. Well, the problem in doing so is their doctor, who'd been a Blue Cross plan forever and a day, a Blue Cross member forever, is no longer a Blue Cross member, because he's now, because he participates in the exchange, is asked to take a much lesser fee for his services and being affiliated with that carrier. While Health Net kept their prices are so high from a premium standpoint, they paid their doctors more, so they've got a bigger list. So at least in Sonoma County, Health Net in the PPO world has been the go-to guy, where Anthem and the others have not. So if you unfortunately didn't recognize this until we got outside, if you did not recognize this fact until the open enrollment period came and went, you're stuck with that plan until we get to the end of this year's open enrollment period. But the good news is you can change it at that point. So we got into a situation where a lot of people were stuck with a plan. Fortunately, some had gone to the doctor in advance, and they recognized the fact that their doctor was no longer affiliated with Blue Cross or Blue Shield. And fortunately, if they found it out soon enough before the open enrollment period ended, we actually switched them out to go to another carrier at that time. So there was a lot of that going on too. Let's see. Okay, so if you're on, let's switch to Medicare for a moment. Now, Medicare, for the most part, has nothing to do with what we're talking about as affordable care goes. And what I mean by that is you can't buy a prescription drug plan, a Medicare Advantage, or a supplement plan through the Covered California website. So you'll continue to make those changes, if any, each year during the Medicare annual enrollment period. So Medicare is still a great place to be, and it has nothing to do with all this Obamacare stuff. Now, some of you were fortunate enough to have what's called grandfathered status, which meant that you had owned a plan since predating, February 23rd, 2010, which is when Obamacare was originally signed into law. So if you owned a plan since before that time, you can hang on to that plan moving forward in the individual world, which many of our clients chose to do, and I'm assuming there are people in this room that did. And for my money, it's probably still a good place to be, because as many of us found out, the new Obamacare type plans were a bit more expensive. So being on a grandfathered plan is not a bad thing. In some cases, it could be, but the whole thing boils down to it depends. We look at everybody's situation individually and move forward from there. Okay, here's probably the biggest one. Everybody is worried about paying a penalty. Well, contrary to popular belief, you don't have to buy health insurance. But if you don't, there is a penalty involved. And they've called it the cute little name of the shared responsibility, which you will see at income tax time, which means that if you're in the individual world, don't have employee benefits, did not buy health insurance, you will have to pay a penalty. And the penalty is the greater of, for 2014, $95 or 1% of your household income, whichever is greater. It gets to be a bit more in coming years. In 2015, it jumps to 2%, or $325 a person, and in 2016 and beyond, it jumps to 2.5%, or $695 per person. So it gets a little bit more substantial, and really, our government is guessing that that's what's going to move many more people as we move forward this year into buying health insurance. That remains to be seen. We'll find that out.
Is that per month or per year?
That is per year, Patrick. Yes. And there's actually a cap on it because some of the penalties that we've looked at have been horrendous. So there's a little known fact that they cap the maximum penalty you have at the national average bronze level premium. I don't know what that figure is exactly, but in many cases it's less than 1 or 2% of somebody's household income. Okay, and so we're almost done with the summary, so you can ask me that question in a moment. If you have coverage through your employer, you can go to the exchange and buy coverage, but generally you wouldn't want to do that because if your employee is providing at least the standard for minimal care, you're in a pretty good place. But know that you can go even if you've got employee benefits. The one catch to that is you don't qualify for a subsidy. So if you get employee benefits, go to the exchange, no subsidy. Now, we're actually having sit-downs with many small employers, and they're trying to decide whether to blow up their employee benefits plan or send all their employees to the exchange. And everybody's situation is different. It really depends on where they're sitting now. But what we do is we provide them with a group quotation, and then we look at each employee individually and their average salary, and that will dictate whether staying with the group way is the best way to go or going individually is the best way to go. And if you happen to be the small employer, which means you have 50 employees or less by ACA standards, then you're not required to offer employee benefits. And there's no penalty for not doing so if that's the way you choose to go. So that concludes the summary part of it, and I will take your question right now.
My question has to do with Medi-Cal and the open enrollment. My
Yes.
understanding was that Medi-Cal, actually people could join throughout the year, not necessarily during the open enrollment periods.
That is absolutely true.
That's the point I wanted to make.
Yes. It is. Yes.
So
Kitty.
you were talking about that on your tax form, you have to either pay a penalty or verify that you have insurance. Since you haven't seen the tax forms, you might not be able to answer this, but is there going to be some sort of line that says, tell me the name of your insurance or when you bought it or something?
Yes, there will. As a matter of fact, before January 31st of next year, you're supposed to get a document from your carrier that provides you with the language that you're going to input at that. But it'll, in looking at your tax piece, it'll say something like shared responsibility, which again is a real cute name for saying way of saying penalty, but that'll be there. And those of us that haven't had insurance will have to contend with it at that time. Anything else right now?
I want to share a
Please.
statistic about Medicare.
Yes.
And why we've gone the direction we have with healthcare. The average citizen in the United States, through payroll deductions, puts in $50,000 into Medicare. And the beneficiaries use up to $500,000 in benefits. So you can see that there's a huge problem. And we have all these baby boomers coming through the system and not enough young people to support them. So that's why shared responsibility is a big issue. What they're trying to do is level the playing field so that everybody has a piece of the responsibility. I think that's important to know that statistic.
Thank you very much. Okay, Bob, let's jump to another screen here. Can you punch this back up? Yeah, let's try that. Okay, let's go to health insurance benefits. And I just wanted to give you all a glimpse of this real quick and bring it up for me, please. Okay, if none of you have seen it, I'm sure many of you have been to the Covered CA website, but this is your outline of the standard benefits now. We've got the bronze over here on the far left, silver, gold, and platinum. And in a nutshell, the bronze with every carrier is a $5,000 deductible. And if you'll pan up just a little bit more for me, Bob. That's enough. We won't be able to see it, but so it's a $5,000 deductible, and everything applies to that deductible, with the exception of 3 office visits that you get for $60 in going to your primary care. And in addition to that, you get your annual wellness exam. But literally, other than that, everything applies to the deductible, and then in a worst case, your out-of-pocket maximum is $6,350. Okay, so that's the bronze plan with every carrier. Bob, if you would just bring it down a little bit more so we can see the name of the plan again. I'm sorry. Yeah, we don't have quite enough of a screen to show this, but okay. Oh, good job, Bob. That's much better. That's much better. Okay, so now we can see them all. What a guy! What a guy! So yeah, here's the $6,350 and the maximum out of pocket I was referring to. Okay. Next, we'll jump to the silver plan. Okay, unlike the bronze, it now has a $2,000 deductible, and prior to the deductible, things like doctor's office visits, specialist visits, urgent care, generic meds, lab testing, and x-rays are at a copay level before the deductible. But then once you get into the hospitalization of the ER, the $2,000 deductible comes into play, and it, like the bronze plan, has a $6,350 maximum out-of-pocket exposure point. Okay, moving over to the gold plan. It's our first 0 deductible plan, and literally everything is at the copay level. Yet it, like the bronze and the silver, has a $6,350 copay. And you may wonder why I keep mentioning that. I look at these plans in very black and white. Usually 75% of the people that come to me say, John, I want a plan with catastrophic value only. I never go to the doctor. So that's why I gravitate to something like this, because this, unlike the bronze and silver, is far less expensive. And so if somebody truly wants those kind of benefits, which as we talk more, we truly find out if that's what they mean, they'll say, geez, I want that copay, so I got to go to the silver or gold. So one of the reasons I point that out is because they're all very much the same to me. But when we get to the platinum level, that drops to $4,000, of course. And this, like the gold, has all copay level, 0 deductible, but the least amount of copay. So I've literally had people that come to me doing the math, and they'll say, geez, I'm expecting, I'm going to have a baby, or I've got a hernia surgery at the end of the year. So they'll literally buy a more expensive plan, and knowing that when the open enrollment period comes, they can downsize once again. So there you have it. Okay, Bob, let's go back to the tool, and let's look at some real examples here. Okay, Bob, I want you to, we're going to use Bill as an example. Bill, as I mentioned, he rarely goes to the doctor, and he just wants coverage in the event of a catastrophic thing. So put a 1 there for me, $50,000 in income. Okay, zip code 95404, and age 57. Okay, and then here's something, I'm only going to point it out now because in a few minutes it's going to change, but it'll say, based on your income and family size, it looks like you're not eligible for premium assistance at this time, so we're going to jump to the See My Options. And See My Options. Okay, hit the bronze and silver button up there for me. All right, it's not working. Oh. I did write them down just in case this would happen. What you should be looking at right now are each and every plan offered at the bronze and silver level. It would start with Blue Cross, go to Blue Shield, Kaiser, and the like, with ending up Health Net on the far right. And that's okay. If you wind up getting it up, that's good. I'll go ahead and continue to talk for now. But what we would see with Bob, like I said, he said he rarely goes to the doctor and wants catastrophic coverage. So we would recommend the bronze plan to him, because the bronze plan starts at $540 a month. Now that's for a guy that doesn't qualify for a subsidy. So we're going to reverse that in just a minute. If we get this thing working, we'll show you what he looks like with a subsidy. Let's try it one more time, Bob. Go ahead and click to See My Options. Okay, it just doesn't want to work. Okay, because it isn't working, like I said, he would be paying $540. So we'll just leave it at that. The Anthem and the Blue Shield and all those are less than that. Now, if we happen to, let's see, because he's curious about what carrier to choose, all of a sudden we're going to drop his income in July. Let's say Bill loses his job, and his income is now half of what he was making before. As a matter of fact, it's not only half, but he's made, let's see, if he made 50 to start the year, he's made 25 at the midpoint. So at the midpoint, thank you for continuing to try there, I appreciate it. At the midpoint, he's made 25 grand, but he has no immediate prospects for a job. So without having immediate prospects, he's made $25,000. And based on the rules for reporting a change on income, I can call Covered California, and Bob's income has now dropped in half. So all of a sudden, his premium for the Bronze Health Net plan goes to $540 a month to $24 a month. Now, a lot of people don't realize this, but reporting income changes up and down are just critical. And so if any of you in the room, or you know of others that are not doing this and they have lost their jobs, or they've gotten a salary spike mid-year, this is ever so critical. I'll explain the salary spike in a moment. So while Bill's unhappy about losing his job, he's very delighted by the fact that his premium's gone way down for the same plan. Now, a couple of months down the road, he might find a job, at which time we'll report another change for him, and his subsidy will lessen, or let's say he goes back up to $50,000, well then that'll completely do away with it. But at least he had that experience for a brief time. And unfortunately, there is no rule book on this. We tried to get one from Covered California, and this is just kind of information like you all are trusting me that I know what I'm talking about. A lot of trust is placed in the people we talk to on these matters, and so we try to get it constantly. We try to talk to a lot of different people to get their viewpoints, and as we understand it, this is factual as we know it right now. So reporting a change of income, I'm sorry, go right ahead.
Oh, I just asked, so, okay, if your income changes, so
Yes.
say you lose your job and you're down to 25,
Yes,
you're subsidized and your cost goes down.
yes.
You get a new job, what's forcing you to report that you've got a new job and said, oh, I'm making $75,000, but I'm going to keep everything as is. So I
Well,
get
you
subsidized.
played right into my trap. That's a very good question.
I'm sure it's happened before.
Well, it's not only, well, we don't know that it's happened before because remember, we're in the testing line on this whole thing. So what I suspect will happen is many or most will fall into that category. Now, when that happens, and they tell you up front, when you deal with them directly, but if you're using an agent or broker, they go out of their way to tell you that you must report income changes. If you do not, so what would happen to him? Let's reverse Bill's situation. Let's say he started out the year at 25 and he's now at 50. At the midpoint of the year, when that happened, let's say, he would get no subsidy at all. So he'd been getting, let's see, he'd been getting $515 in a tax credit. So there's 6 months left to go in the year. He doesn't report it when it happens and waits till the year comes and goes. At tax time, he's going to have to pony up almost $3,100 to pay back the subsidy. So that's what's going to happen to people. It's going to be cataclysmic, I'm afraid, with people that don't know enough to report it. Yeah. A hush usually falls over the crowd when that part is. Yes, please.
I'm wondering, this is not so much about the plan.
Yes.
But for those of you who are helping people and you do the initial coverage and then you have to keep making changes as their income changes, how are you being paid for that? Is the government paying you?
Well, no, we get a commission from the company that we sell. And the standard commission, if it's a bronze level plan, it's a flat 2% of the premium, of the net premium. If it's above that, it can be as high as 3%.
So the consumer doesn't have out-of-pocket money to pay for their changes, so there's no
Right.
reason for them to say, well, I just couldn't go because I couldn't afford that this month, and they should just do it.
They should just do it. They would be smart to do it because, as I say, I'm afraid many people will be caught unaware by all this because they simply didn't know. I mean, we had people that couldn't even get into the system, use the website because it kept shutting down, or get a hold of Covered CA in the first place. And so if that's the only excuse you got, that's not much of an excuse because you would be better advised to at least call an agent, have them take the bullet and wait the hour or two on hold for you, because it just takes a lot of time. And most people don't want to put in the time. But again, I'm afraid we're going to find out a lot of things when this year comes and goes, and especially tax time comes and goes. So, oh, you got it. Way to go, Bob. Okay, so here's what we were looking at. Yay! And this is, and they don't give you the full array of benefits assigned, but this is, you know, we've got Western Health Advantage to start, Anthem, and Western Health again. Now, Bob, if you can you shrink the size of this again like you did before? Good, okay. Down here we've got these little circles. Go here for me. There's another array of plans, and over here we pick up the Health Net plan, which is the 540 that I was telling you about. Oh, you actually changed the premium number. Yes, so Bill, in that example we were using before, originally he had no subsidy, was paying 540. His premium went in half. He gets a 515 tax credit. There's his net premium right there.
Making 25 grand.
Making 25 grand, that's right. Between 250% of the federal poverty level and 138, you fall into this special category. And the special category is, they say, good news, based on your income, the children in your household may qualify for Medi-Cal. Well, they not only may qualify, they qualify for Medi-Cal. So all of a sudden you have a situation where we had a husband and wife, they wanted Kaiser, and they wanted the whole family to be on Kaiser. Well, the kids, based on a certain income range, are automatically relegated to Medi-Cal. And you know, that can be good, that can be bad. Some people are fine with that. We have very good Medi-Cal facilities. Yes?
Can't you have dual coverage? So my daughters are adopted through foster care.
Yes.
And they have Medi-Cal.
Yes.
They're required, right? We just get it.
Sure.
And my work pays for our insurance, but we wanted our daughters to be able to go to the same doctors we go to.
Absolutely.
So can't you have, or you're probably going to go there, but you can't, because we do a coverage where we can do both, right?
Yeah. You know, to be honest, and is that an employee benefit coverage?
Yeah, it's Blue Cross, Blue Shield, I think.
I am not certain. My Medi-Cal knowledge only extends so far, but based on what I know, I don't doubt that you're probably right. And if they haven't given you a problem with coordination of benefits, then you're probably fine.
Yeah. So, I mean, that was a problem that we ran into, because we're like,
Well,
we
it
don't
is.
need this benefit, but
Well,
we have to have Medi-Cal.
And of course, depending upon the family, if you have the wherewithal, if you say, geez, I don't want my kids to go to Medi-Cal, then you may pay for them on a child-only policy, but you pay the full premium for that. And that going rate for kids under 18 is probably about $200 a child per month. So it can get pretty pricey. So there are some options. Now, other people are fine with it. But the fact of the matter is, it happened to us on a family of 5 originally. We were caught completely unaware by it, embarrassed by it. But once we understood it and realized that this message was out there, what we were looking for from that point forward. So in having a chance to explain it up front to families, some people are fine with their children being on it, others not so much. So that's an area to look out for. It may have happened to somebody you know. Let's see. I think that's really the, let's see, we already talked about the example for not paying back the subsidy, so we're good there. Please.
What's the premium difference between platinum and bronze for the same, let's say a family of 4?
Oh.
Premium difference.
Okay. Let's go look at it. You want to leave it at family of 2 or you want to make it a family of 4?
Family of 4.
Okay. Let's change it family of 4, Bob.
I would see probably more than $25,000
Okay.
in this area for a family.
Put it above subsidy level, or?
I would assume that no family could make that $25,000.
I would guess you're right. Let's make that 75,000, Bob. Leave that there. You're going to have to add an adult down here, make the adult 57 too, and then put 2 kids under 18 for them. Yeah, there you go. Okay, see my options. And you wanted to see the platinum, right?
I was curious the difference between bronze.
Sure. Okay. Well, let's look at the bronze. Do you want to look at anything Kaiser Health Net?
Doesn't matter. I'm just curious.
Okay. Let's pan over one and get a Kaiser rate, Bob. Okay, so we've got Kaiser on the bronze at 1,069. pardon me, $1,322 without a subsidy, based on a $75,000 salary. As you can see, quite a subsidy net payment. So we'll always keep the no subsidy and the tax credit in mind. Okay, jump us to the platinum level. Okay, there's the platinum level. Let's look at this guy right over here. Okay, there we go. Wow, $1,000 up from that.
And that covers one adult per month. Is that right?
No, that's two adults.
Family of four. Family of four.
And that's tax credit, that's not a monthly deduction. So you're paying $2,300 a month, and then on your taxes, you get the tax credit. Correct?
No, there are two ways. It's called the advanced premium tax credit, and that's the way most people are taking it. And all that means is that you're making a payment of this amount to Kaiser every month. The government's paying that amount on your behalf. Now, you don't have to do it that way. There are as I understand, a lot of people are really in tune with what they're making and even fluctuating or not. And if you are, that's good. I know mine's pretty consistent. But there are those of us that are not also. And so when that happens, you run the risk. Also, when this first started, we were in October of 2013. Nobody had done their taxes yet for the next year. So people were using their 1040 or W-2s from 2012. Well, there's a real danger in that because your premiums are ultimately based on what you made in 2014. So it really pays to have your hand on the pulse of what you're making moving forward.
Can you read us the numbers? We can't see that.
Absolutely.
What the government pays and what the...
Okay, what the government pays on this one, Kay, is okay, we've got a total premium, if you're not subsidized, of $2,317. The government's going to make a payment of this each month on your behalf, $1,069, leaving your net monthly payment at $1,247. Yeah.
Are you using your household income, or are you using your...
Adjusted gross income. It's actually referred to, or they refer to it as modified adjusted gross income. Usually appears on line 37 of your 1040. I think it's something a little different than that if you're a 1048.
And if you have someone that's covered by their employee plan,
Yes.
can the rest of the family be on this? Or does everyone have to go with the employee plan?
Well, it's tough, but I'll explain. If the employer is providing employee benefits and they specifically exclude coverage for dependents on their employee benefits plan, then the dependents can go to the exchange and qualify for a subsidy. Now, if that's not the case, so if your typical employer nowadays is paying 50% of the employee and little or nothing for dependent coverage, if they leave it open to dependents being included on it, then they are disqualified from being able to go to the exchange and get a subsidy. So that's another thing with the small employers we're meeting with, we're doing a lot of talking about. We're actually having some small business owners rewrite the way that they deliver the employee benefits. In other words, they'll specifically exclude dependent coverage in some cases to get the dependents that added benefit. Yes?
If we have a client that has a package through their retirement,
Yes.
and now they are looking at their options as far as VA, you know, the Obamacare versus their retiree package.
Yes.
Do you lay all that out to them as far as the benefits and kind of weigh which would be in the better of their interest?
Absolutely, yes.
That's
Yes.
huge for us.
Well, good. And any decent agent should be able to provide it for it. But yes, absolutely. That would be something that we do. Yes. Yeah. Okay. Any more questions? Or one more question? Please, Karen.
I'd like to make a comment.
Yes.
This is something I found out recently, that if you signed up during open enrollment last year, and since then you have found out that your doctor does not participate in the plan you enrolled, that does give you a special enrollment period that you can change plans outside of open enrollment. I just did it yesterday.
Is that right?
Yes.
Yeah, this is changing always.
It is, yeah.
I would love to exchange emails with you later on that.
Love it,
because,
yes.
because that's a big one.
Yeah, that is a
Okay.
good one.
Well, thank you. So, and one last thing in closing. there's no reason you should try and do this yourself. Now, I'm sure you've all at one time or another had a relationship with an agent broker out there. The price points are the same at buying through an agency, through Covered CA, or through an insurance carrier. And if you go to an agent broker, they're going to talk to you about all the plans with all the carriers. And like I said, make them take the bullet for you and wait the god-awful hours you're going to have to wait and trying to decipher all this information yourself. And that's all I've got.
Thank you so much.
All right, my pleasure.